Welcome back to Plastic Surgery T&A, where I'm here to serve you real talk behind transformations. I'm Dr. Earl Stephenson Jr., and in this episode, I'll be lifting the veil on what recovery from a facelift actually looks like. I'll be kicking around things such as what happens right after surgery. Not during, not before, but right after. This is the part that no one talks about, no one glamorizes. There are no Instagram reels, no Facebook posts, no TikTok videos about this. So we're going to talk to you about compression, drains, secrets to minimizing bruising, among a plethora of other things. So if you've got about 20 minutes or so and you want to know about facelifts, what happens during the healing, then stick with me. Welcome to Plastic Surgery T&A. Now, we are going to start off with compression. Everybody talks about fajas for tummy tucks, so on and so forth. You need compression initially for facelifts. So when we do a facelift, or when I do a facelift, this is the first stage of the healing process. It's usually a facial dressing with me right after surgery. I don't really put on facial compression right after surgery, and typically don't routinely use facial compression. It depends on the client and the circumstances. But right after surgery, I put on a really soft wrap that sometimes has a little baby oil on it, maybe a tiny bit of baby powder. Just depends. Some places don't like talc. Talc can be a little bit of an issue, but definitely a little bit of a baby oil, soft gauze, wrap around your head, kind of like a circle, kind of like the old toothache wrap, and then we make sure that that is snug but not restricting. So that's what you start off right after surgery. With me, every surgeon has his style. So there, these compression garments are custom tailored, and there really can be from gauze to kind of contour form to just formalized garments, and even what we call a hemostatic net. And that's a type of compression where, if you've seen facelifts, you see these big stitches in the skin that look horrible, but they actually act as a compression, or helps the skin kind of adhere, so you can minimize fluid between the lifted skin and the structures below. So those types of compression and types of compression that are used by different surgeons basically is a style thing, and what surgeons feel most comfortable with and what surgeons have the best results with. I like a soft wrap that gives you comfort, doesn't constrict you, but applies just enough pressure to keep things firm and in place. Why is compression critical? So that's the question you're probably asking. In my opinion, it helps prevent fluid buildup. It can minimize swelling. And, it takes a little tension off of the face, just a little bit. And it helps the skin kind of stick to, as I mentioned before, the structures that have been lifted additionally to those structures below. So we want to make sure that we have good adherence. Additionally, it kind of just gives you a bit of comfort psychologically. You feel kind of better, especially right after surgery. If you got something just kind of, quote, holding your face up, I think it really, really helps. Again, this is a style thing. Some surgeons leave their dressings on 5 to 7 days. I tend to take my dressings off within 2 days of the facelift operation. So, compression is super important. Remember, minimizes fluid buildup and swelling. It helps the skin adhere and gives you some psychological comfort or peace of mind that things are being held up. And the compression dressing isn't really holding up anything, but again, it gives you that measure of comfort. So let's talk a little bit about drains and the drain game. Now, again, It's a style thing. Some surgeons love drains. Some surgeons don't use drains. Some surgeons use different methods in surgery to minimize what a drain is there for. I like drains. I think drains don't hurt. I think they can only help in a situation. So, in a facelift, I particularly like to use drains, and I use a drain. Let me put this picture right back up because I think it helps show us the drain as well. You see this tube right here? There you go. So I like to use a drain that comes out kind of right behind the ear. Some surgeons will bring it out in the scalp, but I like behind the ears, a little bit hidden. I'll put one on each side. It's underneath the skin, just above kind of the next layer, which is typically the muscle or the SMAS, and it helps prevent fluid and blood from building up underneath the skin. Now, there are a few types of drains. You can get a round drain, you can get a flat drain, and some of those drains are called or named Jackson Pratt drains, and they're connected to a small bulb that collects fluid. Or you can use Blake drains, and I'm a fan of the Blake drain. It's a silicone drain, so it's a little softer, it's a little bit more compressionable or compressible than traditional JP drains, which are short for Jackson Pratt drains. Some people will use Penrose drains, which are just like rubber little tubing, kind of like the things that you use for a tourniquet. It's soft, it's rubber, it's flexible, and it just kind of is open and it kind of just drains openly. I'm not knocking that drain. I've used that in different situations for totally different operations and different circumstances, but I think it's a little unsophisticated for this type of procedure and this quality of surgery. In my practice, like I said, I typically use silicone round Blake drains. They are gentle, they're effective, and they allow me and my team to monitor the fluid buildup that comes out precisely so that we know that we are managing that appropriately and that we can minimize fluid and blood from building up underneath the skin. So again, strategically placed behind the ear near the hairline, connected to a bulb. I usually take it out within about 48 hours. Depending on the volume that comes into the bulb, there's typically not much. So as a standard, I'll usually like less than 20 cc's within a 24-hour period, and then we can take the drain out. Now, a lot of people get kind of in their mind about drains. And I kind of understand that. I do this all day, every day. You don't. So that's not a knock. So I know what to expect, but you don't. And so we try to really educate our clients to take a deep breath. This is not going to be a torture chamber. It's not going to be terrible. I use the Blake drains because they are soft, they're silicone, they're compressible, and they come out very easily. And I don't take them out. Now, my staff has been expertly trained. They're gentle. They are thoughtful. So they take the drains out. Not that I'm not, but I'm a big guy, big hand. So people kind of get a little intimidated by that. So I let my staff and I've expertly trained them to take the drains out. So how does that happen? That usually happens on the first visit to the office. I always advise patients or clients to take a little bit of pain medicine before they come to the office. And of course, they'll have someone drive them so they can't drive themselves. And then basically, there's a stitch that holds the drain in that's clipped. That does not hurt. The drain is taken off of pressure. So we take the suction bulb and we release it. And we just gently, in a controlled manner, just remove and slide the drain out. And bam, we're done. That's all you can expect. It may feel a little strange as it's moving through, but typically no pain, definitely no excruciating pain. So, again, drains are super important in my practice. Other plastic surgeons may use other methods, but I like the drain and I like to take it out with in about 48 hours, usually at your first appointment. Remember, drains prevent fluid collection like hematomas. That's blood collected underneath the skin. And I got a good example of that, what a hematoma may look like. So we don't want this. This is bruising, but this is bruising with a collection of old, non pulsating blood underneath the skin. And that can do two things. That can put pressure on the skin that's been lifted and repositioned and cause it to lose its circulation, which can create a wound, and it can actually cause the skin to potentially die. And we do not want that complication. So the drains are helpful with that. So we definitely want that drain in to minimize that potential complication. We also want it to minimize a seroma, which is a clear fluid, which is a healing fluid that occurs in every operation. It bathes the operation underneath, and the body uses its lymphatic system to kind of soak that up. But sometimes that gets overwhelmed, and we need to add a little security blanket like the drain. Typically, faces are not really seroma prone, maybe more like body procedures like tummy tucks, but typically it can, if a seroma were to occur, then it can definitely help that as well. Again, these fluid collections can wreak havoc by putting pressure on the skin, and they can also be a source of kind of food for bacteria. So we don't want to have any type of infection. So we really want to minimize that. So again, drains are super, super important. Now, again, we're going to have bruising. We don't want bruising like this. And so in my practice, we want to minimize bruising that is typical bruising, not bruising that produces a collection of fluid or old blood. So there are a couple of strategies that I love to incorporate for my facelift procedure patients and clients. I will touch on the OR a little bit. In the operating room, I use a medication called TXA, that's tranexamic acid. And what that does, it minimizes bruising or minimizes bleeding that can lead to bruising after surgery. It can be applied through your IV. It can be applied within the local anesthetic, the Novocaine that I use in surgery. I typically like to use it there, but it can be used in either place. It can also be given orally, but of course, during surgery, you can't do that, but it can also be given orally. But I like to use it in the local anesthetic or the Novocaine that I use during surgery. You can also use a couple of things before and after surgery. I'm a huge fan of Arnica Montana, and I'm a huge fan of Bromelain. Arnica Montana is a natural anti-inflammatory herb that helps minimize bruising and swelling. I typically start at about 3 days prior to surgery, and then I actually have my clients use it for about 5 days after surgery, and it's a little freestyle. If somebody's doing super well, we can stop it then. If somebody's still lingering with a little bruising, I kinda extend that. Also, we recommend Bromelain. I usually give that as a combination pill. Bromelain is actually from pineapple. It's an enzyme from pineapple, and it's known for its anti-bruising and anti-swelling capabilities and some healing properties as well. So we give that as a pill form before surgery, combination pill, and it really, in my opinion, helps. I've done cases for face to breast to body when I didn't use bromelain, and I've done it now with bromelain and arnica. I think the bruising is much, much less. And so that makes you, the client, the patient, feel much better psychologically that you're improving, and you are improving, but that does help you feel like things are moving in the right direction. So you can bounce back faster, and you look more like yourself sooner, which helps you for sure. So these are the tools that aren't glamorous, aren't fancy, aren't flashy, aren't click worthy or like worthy, but are so important. They're really foundational to your recovery and what you can expect really in that first 48 hour, 72-hour block of time after your facelift. So now we're going to jump to the 2 day mark again, but we're going to talk a little bit about how I proceed at that point. You've had the surgery's done, you've gone home, you've not seen me yet. And I typically like to follow up with my clients 2 days after surgery. And we kind of touched on some of the reasons why. We got some things in place that we need to check. And so 2 days after surgery is really crucial for me. Again, you know, surgeons do different things based on their experience and what they like. You know, I don't see you in a week. I don't see you in 5 days. I feel really comfortable seeing you within 24, definitely 48 hours, but 48 hours, because those first 2 days can shape really everything. So I'm a I'm a 2 day guy. So we'll see you in the office within 1 to 2 days. This is again comforting me, but it really should be comforting to you because I can catch complications early. We can optimize healing. And then, of course, everything's about doing those things, but also giving you peace of mind. And that's so important to me and so important to my staff. And that's a founding principle of my practice. So, basically, in that first visit, within the first 24 to 48 hours, I'm checking for a couple of things. The first thing I'm checking for skin integrity and viability, or if the skin is healthy and alive. This is a top priority because I've lifted the skin, I've lifted the muscle. I want to make sure the skin is really healthy, has a good circulation after all that work, and is not compromised. So, what if it is compromised? What does it look like? Well, you're gonna maybe have some bruising, and that's fine. But if you have some really deep, intrinsic purple areas, that's concerning to me. That's really concerning to me. And that may indicate that the skin has a compromised circulation or blood supply. Worst case scenario, the skin is dark or leathery, and that's more serious. That's really a sign of skin death or skin necrosis. Some people will use subtle changes in the temperature of the skin to kind of clue them in by using certain probes. I don't use that. I think the skin can really tell you to tell, and experience with things like that, unfortunately, not only on the face, but tummy, breast, nipple, what have you. Give your experienced plastic surgeon the knowledge and the tool bag to recognize those things early and change them around. So 2 days, if I recognize it, I can do things to change that around, to get us on a path to a smoother recovery. Occasionally, and this doesn't happen very often, first and foremost, but occasionally, even though I see it 2 days, sometimes we can't change it. We just have to follow the course. But then I let you know we are steering off course a little bit. This is what we can expect, and this is how we're going to get back on the runway for a smooth landing. So, again, the first thing I check for during that first appointment is skin integrity and health. The second thing I check for would be signs of infection. This is really super rare. It's rare to have a facelift infection or an incision infection, but it can happen. And it's rare because obviously we use sterile conditions in the operating room. I pride myself on great up to date surgical technique. We have the good fortune of working with the face. The face is so forgiving. It has an excellent circulation, an excellent blood supply. So it really can kind of cover up for some things because it can really heal itself super well. Also, we and I give you antibiotics during surgery and antibiotics after surgery. But nonetheless, you're coming in that first visit, I'm checking for infection. We want to make sure that we don't have any of the following things. We don't want any bright red areas. We don't want any unusual warmth of an area. We don't want anyone to, hopefully don't have worsening pain of an area, especially isolated versus other areas. We want to make sure that the swelling is fairly symmetric. Swelling won't be completely even from one side to side, but we want to make sure there's not one side that is immensely swollen. And of course, we want to look for drainage. We want to look for any type of drainage, whether it's clear, whether it's yellow, whether it's green, and that just indicates that your immune system is in there trying to fight, and there actually is some type of bacterial infection, and we need to intervene. And if I see that early, it can be minimized because it probably hasn't gotten out of control and is very isolated. Certainly nothing like this. This is something as a picture, not of my client, but just a picture I have. That's something that is it is isolated to an area, but it's a little bit more extreme, and I don't expect that at 2 days. I would expect 1/10 of this area if I had a problem, and I could, jump in at 2 days and minimize it and prevent it from looking like this if we didn't see you soon. So, again, what we look for: bright red areas, unusual warmth, of course, worsening pain, any asymmetric or pronounced swelling, and certainly drainage. And you can have some other things. You don't really feel great. I mean, worse than you anticipated. You're not eating, you're not drinking, you feel like you have a temperature. You may even have night sweats. So, again, that's worst case scenario. But again, seeing you in the first 2 days, even if you have a smoldering infection, we can nip that in the bud. Also, to the same effect, we want to make sure, and I want to make sure, the third thing I look for is integrity of your stitch line or incision line. As you know, the incision goes and hugs the eyebrow. It comes and hugs the front of the ear typically. It curves around the earlobe and hugs the back of the ear and then comes up and then follows the hairline in the back. And we want to make sure, and I want to make sure that that stitch line is together. It's not gaped open or looks like it's under stress or that it may gape open at some point. So we want to make sure that we have good integrity of that skin stitch line. Because if we don't, then we're gonna have a not so great aesthetic outcome. And obviously we've got some healing problems if we don't. And I need to figure out why that is occurring. You know, the edges should be touching. There shouldn't be a lot of tension on it. If there are signs that the area is opened up significantly, then I don't restitch it. A lot of clients say, "Well, why don't you stitch it back together?" The edges are inflamed from surgery. Doesn't mean anything, all let me rephrase that. All edges of the incision, whether they're intact or not, are inflamed. Ones that are not intact are increasingly inflamed, so they don't have the same strength. And so when you put a stitch in, it just kind of tears through. Or if you're able to get a stitch in and it kind of brings it together, just it's a matter of time. That skin is not going to hold that stitch, and that stitch is going to be floating, and it's just going to make the area worse. So, we talk about if it's a significant opening, the dressings that we may need to apply. So we need to go to some type of dressing care. And that can be a simple gauze that's a little moist, followed by a gauze that's a little dry on top, and then and then a piece of tape. It could be sophisticated, like a little medicated gauze called Zero Form. I like that as well. And then, of course, you need close monitoring of that area. I really try to educate my clients on how to care for their incisions, keeping them clean and dry and protected. And then obviously they have the hotline directly to me if they have any concerns outside of the times I see them. So the first visit, we're looking at the skin integrity. We're looking at the incision line integrity. We're looking for infection. Swelling, bruising, shaping, contour will all come with time, but that's what I want to do. I want to make sure that that is good. So, follow up certainly matters. It helps calm your fears. Surgery isn't the end. Surgery is only the beginning of the healing journey. So, I am very vigilant early on. Trust me, my clients notice this. I often hear them say, "Hey, doc, I feel like, you took good care of me. I didn't feel like I was on this, healing journey all by myself. And that, again, is important to me. It's a founding principle of my practice, and I instill that in all my team members. So we all have that that principle. We want to make sure that you feel cared for. So now we've gotten to 2 days after surgery. I have you back another 2 days later. You're like, oh my God, this guy's killing me. And why do I have you back then? So we've gotten through the first 2 days. We've looked at the skin integrity and health. It's good. We looked for infection. There's none. We looked for um, any, I lost my train of thought. Skin integrity, health, and look for any infection. So there you go. Those are the three: infection, skin integrity, and health, and incision integrity and health. So once we got through that, we've taken out the drain. I've taken off the dressing, compression dressing, and then I have you back 48 hours later. So now we're, within the first week, I have seen you twice. And people are like, why would you want to see me twice? Because you're going to have questions like, when can I wash my hair? When can the stitches come out? When can I walk around at Target? Uh, you know, can we talk about that? When can I work out? When can I, get frisky with my partner? These are questions that you're going to start to have as you get clear. The main point for this next visit, the second visit within the first week, is I want to take the stitches out. I want to get those out. The skin of the face is really robust as far as its circulation, so that means it heals quickly. And we want to make sure that it gets stitches out within 5 to 7 days from the time of your operation. In this appointment, I would love to remove all the stitches. I think that's great. That makes sure that the skin will heal beautifully. Occasionally, some of the areas are a little slower to heal, so I may take out some of the sutures. It may be in a staggered fashion. So I may take out every other one at this appointment, leave others, and then maybe 2 days later to 3 days at the most, I'll take out the remainder. Because what I want to do is make sure that that skin is supported and regains its natural seal and starts to regain its natural strength. So definitely want to take the stitches out at the right time. I don't want to take them out too early, which will increase the chance that the incisional integrity will lapse and you'll have a wound opening or an incision opening. But we don't want to take them out too late either, because it can lead to suture tracks or marks. So you'll have that classic Frankenstein mark, and no one wants that anywhere, especially their face. So stitch removal or suture removal is a fine balance. So I need to monitor that closely. And so that's why your follow-up visits are so packed within that first week. So we try to be proactive so that we can give you exceptional results. So now we've done the first two operations. That's what you can expect. Within the first week, you're not feeling great. You're, slowly feeling better. You're groggy. You're eating less. You don't have much energy, but that's to be expected. Your face feels stiff. It feels swollen, but it'll get better. What we then need to do is to make sure that we're managing the pain well during that first week. The swelling during that first week will peak at about 3 to 5 days, but still should start to then digress or ease within about 7 days. If you need more pain medicine during that time, I usually will give you pain medicine. And, patients are starting to kind of understand where they are. Stitches are out, drains are out, dressings are off. They're feeling a little more energy day by day versus the first day or two, which is they can't remember maybe. But they started asking, what can I do? This is still not the time for gym. This is not the time to run errands. This is not a time for yoga. Could it be for light walking? Yes, for sure. And this is basically around the house, or if it's nice outside in the yard briefly. Why do we want that? the main reason is I want you up and walking, so it minimizes your risk for a blood clot, or what it's known as a DVT, which is a deep venous thrombosis, which is rare with a facelift, but it can happen with inactivity after surgery. So we want you walking around of the house at least. Again, no yoga, no errands, no running to the store for groceries, no cooking, no gym, just walking around the house. Sometimes I'll tell my clients, just get you a little egg timer and set it for 5 minutes. And every 5 minutes, maybe you get up and walk around the living room. Your future self will thank you for getting up and moving around. In my opinion, this is not medical science. It makes you feel better. It makes you feel like more like yourself. It helps open up your lungs. You take deeper breaths so you don't get mucus and things clogged into your lungs. Again, from a medical standpoint, it minimizes the risk of having a blood clot. So, even though rare with facelift, it still minimizes that. So, we want you doing those types of activities only during that first week. The last question I get during that first week, doc, my girlfriends may come over. I don't want them to see me like this, or my sister-in-law, or what have you. Can I wear makeup? It's a great question. We're at this weak point. Short answer is not at 7 days, maybe at 10 days, but not before 10 days. What we want to make sure is that your incisions are sealed. We don't have any infection, no open areas. We don't want to risk infection. So your bruising has usually at that time, about day 7, 8, 9, 10, change from this kind of purplish to kind of that yellow green stage. Concealer stage makeup at that time, or concealer makeup at that time, at that stage, 10 days, can be okay. It's light. It has to be light. It can be a tinted moisturizer. It can be a light concealer. If you have to be in public or a meeting, or you have some type of video conference, sometimes if you just need to feel like yourself, you can do it. But I wouldn't advocate, putting on your face every day if you don't have to, if you're just going to be in the house around your family. But if you have to, a tinted moisturizer or a light concealer. We want to make sure, though, that tinted moisturizer or a light concealer is mineral based and not acne producing. So we can let your skin breathe while you recover. So these are the things that happen in the first week, the questions that are asked, the plans that are laid out, the progress that is made. So again, this is where we are. Now, we're kind of cruising to the next week. I'll see you probably in a week. So now we're at 2 weeks. So let's talk about 2 weeks to 6 weeks. So at that point, we're expecting a couple of things. We're expecting obviously the swelling to decrease. We're expecting it to decrease significantly around your cheeks and in your neck. Bruising phase, as I talked about before, and then disappears. Your facial contours start to come to play. You start to look a little bit more natural. You still have some tightness, not like at day 2 or day 3, but you still have some tightness from weeks 2 through 6. But you start to look like yourself, move like yourself. You may even sleep better. Your appetite will definitely bump up a bit. Thinking may become clearer, definitely should become clear. And this can give you a bit of confidence for sure. You can feel like, hey, you feel good in your body. You're feeling, a little bit more refreshed, and you're looking a little bit more like you. So in that time period, I see it the next week. And if you're doing great at the 2 week period, we may see you at the 4 week period. So we lengthen the time period between recovery appointments based on how well you're doing. And then you can see for yourself, if you chronicle it or you just put it in, flag it in your mind, that your edges of your incision don't look so stark. They look like they're softening. Again, swelling subtly resolves. Your skin kind of looks a little bit more refreshed and look like yourself. You may get some nerve sensation back. There may be some temporary weakness to one of the corners or both of the corners of your mouth. This is temporary. As that nerve recovers with your overall recovery, that movement will recover as well. So it's a gradual recovery, things getting better. You're probably getting back to work during that time period. You're moving more freely. You may actually want to go out with your partner, husband, or friends briefly during that time period. You can start to think about your photo shoot. We use Robinography. That's my wife. She has a great branding and uh, lifestyle photography business. You can start to think about your pictures. So these are things that are happening in the first, in the 2 to 6 week healing period. We really want to make sure that we are staying on top of you as far as your recovery. And if you're doing well, we just kind of put distance between each one, but doesn't mean you can't contact us, doesn't mean you can't uh, voice concern. We're here to help you every step along the way for sure. So remember, day 0 to 2, compression, head dressings, drains, those are coming out. Day 3 to 7, you're having bruising. Hopefully, you've taken your arnica and your bromelain. That's minimized. You don't have a hematoma because we used a drain. We use compression. Where that bruising and swelling is going to peak at about day 3 to 5 and start to get better. We're starting to take out stitches or sutures at that time. Weeks 2 to 3, swelling subsides, especially around the cheek and eyes. Neck is improving. You can probably wear some light makeup starting around day 10 if you need to. And as those days go further along down the healing and recovery path, you can start use makeup that is mineral based, non acne prone, tinted moisturizer, concealer. More frequently. And then about week 4 to 6, swelling is mostly resolved. You're starting to look more natural. Sensations are more natural. Movement of the face is more natural. You're more active. Again, you're definitely back at work. And then pacing yourself because your energy is still building to where it was before surgery. And then weeks 6 to 12, in my opinion, subtle changes and improvements to really get you to your fantastic transformation will occur. You will notice those things, your kids will notice those things, your husband, partner will notice those things, but you will then be in the fabulous phase. And then at week 12, basically is where you are. Now, the incisions will continue to soften and blend and fade over the next. Heck, we're at 12 weeks, the next 40 weeks. So over a calendar year altogether from the time we put in the last stitch at the operation to a year after, those incisions are softening and blending. So those will continue to get better and they're well placed. So they will be hidden. You can wear your hair down. You can even wear it up at some point, especially at the 6 week phase, 12-week phase, and moving forward, that you don't have to worry about putting your hair in a ponytail and having a scar, a surgical incision that is still harsh. So you will continue to improve rapidly. So that's what you can expect. Every client is different. They'll have different timelines. This is a general timeline, but we are here. That's the main thing for you. And that you're going to have these time stamps of stitch removal, drain removal, swelling, the need for encouragement. That there can be some psychological downtime, and we're here for that. Your family's here for that. Surround yourself with positive people who are encouraging you, and we'll get you to the other side. So we see you from day 1 to week 12 and beyond. I tailor your appointments based on your healing milestones. And, they start close together, then we stretch them out as you get better. We just don't want you to feel alone because you're not. This is, it- our focus really isn't just on your surgical result. It is, but it's not just on the surgical result. It's really on making sure that your recovery is full. and that your confidence is full and that you're returning to yourself for sure. So we want to make sure that we do that. We offer that. Again, we want to provide you great surgical results, but we want to provide you with the confidence that you know that you're in the right hands. This is a collaborative journey. It's been built on trust between me, between you, and your closest inner circle who will be caring for you and care about you. So I take that to heart. So if you are interested in a facelift, then I encourage you to start a conversation with me. It's really simple. You can call my office at 770-466-4700, and we can simply schedule your consultation. If you're in town or close, then encourage you strongly to have an inpatient or in office consultation. If you are not local or not regionally close, then you can have a virtual consultation. But at some point, I'll need to physically meet with you. I'll need to physically examine the structures and make sure that we have the right plan for you. So it's as simple as that. Why should you have a facelift with me? For all the reasons that I outlined in this, podcast. But there's some really strong indicators. Besides that, I'm certified by the American Board of Plastic Surgery. That's important. Now, there's some surgeons that are out there, head and neck surgeons that have facial plastic surgery training, and they're certified by the American Board of Facial Plastic Surgery, and that's okay too. But I'm certified by the American Board of Plastic Surgery. And on top of that, unlike my other cohorts or colleagues in plastic surgery, I'm additionally trained in oral and maxillofacial surgery. So I started there. I understand the structures of the bones of the face. And with my plastic surgery training, coupled with my oral surgery training, I understand the soft tissues, the bone, facial aging. So I am uniquely trained to meet your needs if you're a candidate or want to discuss facelift surgery, neck lift surgery, eyelid surgery, chin surgery, anything pertaining to the face, facial implants. My training sets me apart and sets my practice apart. And lastly, I borrow this because I am a member of good standing from the Aesthetic Society. They have a really cool, I think, moniker logo for upcoming meeting. I think it's really cool. So I got borrowed it. I can use their logo because I am a member, but I'm a member of the Aesthetic Society. That's the real key here. So not only am I board certified plastic surgeon, certified by the American Board of Plastic Surgery, because I am certified by the American Board of Plastic Surgery, I could be a member, and I am a member in good standing. Oh gosh, for many years, I don't even know how long, greater than 10, maybe 12 years of the Aesthetic Society. So again, I thank you for joining me. If you want to talk, here's my number. If you are not quite ready for that and you want to check me out, go to my website. Here's my website. I also have a YouTube page where you can see all kinds of videos like this. I have a series called Sketches in Surgery where I actually draw out on a whiteboard various portions of all of surgery to explain it. So I encourage you to watch that. I have this podcast, Plastic Surgery T&A, that's talk and advice, where we just uncover the real talk. We don't fluff around. I want you to have the information you need to have so that you can make the best decision possible for you. That may be working with me. That's what I ultimately want. That may be working with somebody else. That may be you don't want to do it at all, but I'm going to give you the information to empower you to make the right decision for you. So I encourage you to jump onto my YouTube channel. With that being said, thank you for watching. Tune in for next week's episode. I am Earl Stephenson Jr., Atlanta board certified plastic surgeon and facial rejuvenation expert. Tune in next time. And until then, be safe, be well, and peace.